Hi everyone. Today, NORC at the University of Chicago, partnering with the UCLA Center for Health Policy Research, will be presenting a training on how to ensure fair representation of all communities in data analysis. I'll first introduce myself. I'm Tiara Porter-Beal, a research scientist in the Bridge at NORC, and I'll also be joined today by my colleague Brenda Betancourt, a senior statistician in our Statistics and Data Science department. Before we discuss how to ensure fair representation of communities in data analysis, I first want to define what fair representation means. Compiling a multidisciplinary literature review of definitions, including from the UCLA Center for Health Policy Research and the CDC Foundation, we define fair representation as a worldview about the use of data to promote human health and well-being of everyone and contribute to fair, impartial, and just results that promote policy and programmatic change. Broadly speaking, fair representation recognizes the importance of issues related to power, bias, and discrimination in data acquisition, analysis, and interpretation. Rather than a methodology, ensuring fair representation in data is a mindset that requires using practices and approaches across the data lifecycle to promote programmatic change that benefits all people. The data representation framework serves as a four-step blueprint for how to consider fair, impartial, and just approaches when collecting, analyzing, interpreting, and disseminating data. The first step in the framework considers strategies when collecting data, being mindful of which populations are included or not included and can be identified in the data set. The second step, processing, focuses on representation and accessibility, especially among small, underserved, or historically excluded groups. In step 3, analyzing and reporting, this focuses on how results are interpreted, tabulated, and conveyed. Lastly, step 4 focuses on data distribution and dissemination, with considerations on disclosure and barriers to access. While step 1, 2, and 4 of the framework are discussed in other trainings, the focus of today's discussion is focused on applying a fair and just lens to data analysis. While the data representation framework outlines considerations across the 4 stages of the data lifecycle, data representation dimensions take it a step further to provide distinct areas of focus, each with systematic processes, strategies, and practices that can be used or overlaid throughout the entire data lifecycle. The first dimension focuses on centering and empowering community. Instead of extracting and siloing data from the communities we seek to serve, it is important researchers include community members before, during, and after data collection. Aligning work with this dimension shifts power to the community, promotes community self-determination, builds community trust, and leads to having valid data. Dimension 2 focuses on building inclusive data systems. Leaning into this dimension means that researchers acknowledge and endeavor to mitigate potential biases in data that may lead to lasting harm, distrust, and acknowledging researcher positionality in data fields. Dimension 3 challenges researchers to look beyond data as just numbers. Oftentimes, researchers view data, notably demographic data, as a variable that is free from bias. However, analysis and interpretation of data requires remembering that there are real people behind the data, with real lives and stories. Dimension 4 expands principles of data privacy and governance. When applying a fair lens to data privacy and governance, researchers can drive community inclusion and facilitate community agency to protect and access data systems with the most impact on their own lives. Dimension 5 explores data democratization. Promoting data democratization can shift understanding and ownership of data, its access, analysis, and use to the communities where data is collected and works to build data literacy where all can derive meaningful information from data. So what do each of these dimensions look like in practice? A strategy to center and empower community is in convening community advisory boards. Considerations when convening a community advisory board is to develop formal processes and bylaws to make sure that roles, goals, and expectations are clear from the start. Be mindful of meeting times, frequency, and location, and be sure to compensate all members for their time. Also consider members being co-authors on research products, including articles, reports, and conference presentations. In addition to ensuring collaborative research teams through community advisory boards, it's also important each member of the team acknowledges, understands, and reckons with the identities they bring to the data. The inherent process of scientific professionalization, especially when coupled with the complex interplay of researcher and participant social identities, can situate researchers with power over participants or even other researchers in a group. A tool that our team has used in the past to conduct a self-reflection exercise is the Harvard Implicit Association Test, a tool that can help researchers examine positionality, challenge views, and create an inclusive mindset at the start of a project that later influences the data collection and analysis approach. More to come on strategies regarding data disaggregation during the analysis stage, but focusing on intersectional analysis techniques that incorporate multi and mixed methods that blend narrative and lived experience with statistics and numbers in order to provide a more holistic understanding of the story behind the data is a consideration for Dimension 3. Strategies to apply Dimension 4 include providing clear, informed consent and going beyond translating materials, but extending to transcreation and transadaptation with members of the community to truly honor the cultural diversity, dialectal differences, and linguistic variation among groups. These approaches ensure participants and communities can make autonomous decisions related to their participation and involvement. Lastly, a practical example for Dimension 5 is to apply inclusive and accessible data visualization strategies. When creating figures or graphs, consider colors, icons, and shapes so that they are clear and prevent reinforcing stereotypes. Researchers can also consider order labels to prevent reinforcing dominant groups as the reference category. Now, I'll pass it to my colleague Brenda to discuss ways to apply these strategies and frameworks to analyze differences in data.
Thanks, Yara, for the introduction. We're going to focus on analyzing differences in data using descriptive statistics and visualization techniques. Exploratory data analysis is an important tool to identify imbalances in data. Some of the steps involves computing descriptive statistics by groups. The groups can be demographic characteristics. It is important to perform cross-tabulations, say by gender, age, geographical region, or any other characteristics of interest to explore multifaceted identities. And finally, we want to use data visualization to identify and summarize patterns. On the right, we have an example of a bar plot from Chicago Speaks from 2024 that is showing the perception of job security by race. Ensuring fair representation of small populations in data analysis can be quite challenging. This is because of confidentiality reasons. For example, reporting cross-tabulations by small geographical areas and education could compromise the anonymity of survey participants. One possible solution for this is to report for higher levels of disaggregation if possible, if this is going to be public. In some cases, that information can be suppressed also, and in that case, you can use qualitative themes instead of reporting the numbers to capture and report the unique experiences of these small groups. What is considered a small population is generally application specific. For example, here we have data from the National Center for Health Statistics. This data is on binge drinking prevalence among adults in California, and we have this data disaggregated by race. So notice here we have two categories that were not reported, and this is because NCHS does not report log counts or any rates or proportions that are derived from small numbers. In this case, the rule is they don't want to report anything that has a denominator that is less than 50. This can change depending on your specific application, but in general, this is a good rule to follow to protect confidentiality and to ensure data reliability. Here, I have another example of what can be considered a small population. This is the homeless population. When reporting results on data for this population, we have to be very careful. This is a group that has a lot of specific characteristics that are sensitive, for example, higher rates of mental illness, substance use disorders, chronic conditions. These are things that NCHS is interested in reporting, but because of the sensitivity of the data, they do not report the numbers specifically. In this case, you can use high-level narratives that capture overall trends, cluster similar groups, or simply highlight outliers when you're reporting on this type of population. In data analysis, it is of interest to compare groups using different measures. Common ones are using rates and ratios. We generally have a reference group or a benchmark that we want to compare to. We can do this within or between. Commonly, we can use indices based on the ratio of rates for two groups. So, for example, looking at educational disparities by age differences, mortality life expectancy by sex or by geographical region. We can also use more complicated measures such as multidimensional indexes. In this case, we can assess differences across multiple groups or quantify dispersion within and between subgroups. So for example, looking at rural women versus urban men. When analyzing differences by group, it is quite common to choose reference groups and report results based on that reference. For example, the most common practice is choosing the majority or dominant group. So if we're analyzing differences by sex orientation, it would be pretty common to use the heterosexual category as a reference group. We can also just choose the best or median. So for example, choose the group with lowest diabetes incidence if we are reporting this by race, for example. It is common also to use just a historical standard. If we're talking about homelessness rates in 2025, we could choose the data from 10 years ago as a reference. It can be also policy relevant. So for example, using veterans in homelessness studies as the reference group for reporting our results. Or it can be within group. For example, if we're looking at workplace differences for women in STEM, we can do that by career stage. And the reference group could be just the most junior people, as an example. Data visualization is an important tool to identify and analyze differences in groups. This is useful because it allows us to report multiple outcomes for multiple groups in a more digestible way. Examples are bubble plots, heat maps, Sankey charts, and a little bit more advanced is interactive dashboards. Here I have links with examples for a Sankey diagram, a bubble chart, and an interactive map that you can explore on your own. We're going to go over the first two in the next following slides. The following is an example of an interactive Sankey diagram. This is from data of the survey of doctorate recipients. The interest here is to look at what occupations STEM doctorates pursue. On the left, we have the field of degree. On the right, we have the field of occupation. The lines are connecting the two, and the thickness of the line represents the proportion of people in each category. This is a good example representing multiple outcomes for multiple groups. Now we have an example of an interactive bubble chart. This is also with data from the survey of doctorate recipients. Here we're looking at the number of doctorates per each field. So the size of the bubble represents the number of people in each group. And on the right, you can see a disaggregation by employment sector. This is an example of a very good way of representing data for multiple outcomes and multiple groups. Now we're moving to our closing remarks. Of course, descriptive analysis is a very important tool to identify and analyze differences in data. However, they have their limitations, right? So we are not considering any confounding variables or complex interactions when we're just doing a descriptive analysis. And for this reason, we cannot use descriptive analysis for prediction purposes or to determine any causal relationships between overlapping identities and outcomes. If we want to do that, then we have to move to more sophisticated data analysis tools such as modeling, and particularly use, for example, hierarchical models to estimate group level effects. Additionally, if we want to answer more complex questions on possible interactions, then we have to introduce interaction terms in our modeling approach to highlight the joint effect of different categories. If we go with these more advanced techniques, then we can answer more sophisticated questions like the one example that I have here, that is, can sex, race, education, age, marital status, and income significantly predict the risk for binge alcohol use among adults with a major depressive episode? Of course, those are very complicated questions, but descriptive methods are necessary as a first step before we can even get to that point. Thank you so much for your attention, and I hope you learned something from this talk.